So I guess jumping into some of the details on an upper and lower blepharoplasty. So
Mhm.
let's just take each one separately. Some people come in and they just think, they just see, extra skin on the upper eyelids and they just want that taken care of. I find that it's less common that people are just coming in like requesting a lower bleph, but then of course often you're doing kind of all four on someone. So if someone were to come in and their primary concern is just the upper, like sort of how does the discussion go? Everything from, I guess, in your office, probably vision also plays into it, and kind of should we check your vision and things like that. So I guess what's your kind of your algorithm for it?
Sure. So I would say, yeah, the people that I see that ask for lower lids alone are usually on the younger end, actually,
Mm.
where they have, some outpouching, the start of that herniation or the
Yeah.
dark circle isolated without a lot of hooding necessarily on the top. But yeah, the majority of people have some form of hooding. And, depending on the shape of their eye, my goal isn't always to remove all of that. I mean, especially in the guys that I see, that I'm doing like in office blephs or in the OR blephs, I don't want to take them to like this sculpted look where they're wide open. And I think that looks typically bad. I mean, if it looks good, matches the face, then fine, but not on most people.
Yeah.
And so I think the discussion is a multi-layer discussion. So certainly you have like the skin and
Yeah.
even, the orbicularis, the muscle, the top layer there, but then also the fat pads and contouring, and there are multiple fat pads there. So on the top, you have these two. This one is the one that is sort of not metabolically active. So you see very thin, frail people that as they get older, and for some reason they have this area pooching forward. And that's because it's just not a metabolically active fat pad. It's like the fat around your spinal column. You can't,
Hmm.
as much as you run, you can't really get rid of that fat. So
Yeah.
you need it. It's supportive. So there is definitely contouring of that. And then sometimes you'll have that deformity across the top lid, and I can even, move the fat and transpose it into uppers as well. And then one thing that I think gets often overlooked is the lacrimal gland. So you have a gland that's on the outside corner here, and that is not a fat pad. It's a gland that produces the watery part of the tears to your eye.
Hmm.
So you can imagine removing it would cause a problem. And I have a lot of patients who have this, area that's falling forward, and it's because just like other tissue in your body, it has a tendon that attaches to bone underneath this edge of your brow. If that tendon loosens, it can drop out and then start to bulge, especially when people look to the side. And I've done a lot of surgery to just place the lacrimal gland back in its original position, support it. And something that I look at before I do surgery is the surface of everyone's eyes. So the eye is the only wet surface on the outside of your body. I mean, your lungs are wet and so on. Your mouth is wet inside your body, but the eyes are on the outside, and
Hmm.
that's why blinking is mandatory, when you're refreshing yourself. And if you try
Yeah.
not to blink, your vision would get blurry because the tear lake that sits on the surface of your eye would start to break up after several seconds. And so if you tuck someone too open, then they can have a permanent dry eye from it and be miserable.
Yeah.
So I'm sure you've seen after even like trauma reconstructions and stuff like that, where people have their lower lids sort of tucked down and scarred down in
Sure.
position.
Sure. Yeah.
And so if you have the inability to close your eye, like in Bell's palsy, for example, then you know that could be a difficult thing to fix. And so we never want to create that problem or make it worse in people who are on the border of already a pretty dry eye and tip them into a position where they're going to be miserable. So, but I warn people when you have a blepharoplasty that there is a distinct possibility your eyes will be dry while you're healing, like in the
Hmm.
first immediate post-operative period, because it's sort of shock to your lids. You're not closing fully as 100% effectively as you would normally. And so as a result of that, until you get to that period where you have less swelling, your lids are not going to function at 100%. And
Yeah.